1.7 billion people currently suffer from musculoskeletal conditions, and they're treated with devices that are clunky, visually unappealing, and not personalized.
I have chronic pain, osteoarthritis, and also carpal tunnel syndrome. I was given splits, which are supporting the thumb. They can be very uncomfortable. You tend to sweat in them, which obviously is not very nice, and then eventually they can even get smelly, and you cannot wash them, so that's a massive issue. And they are not very easy to put on and take off.
So having a homogeneous material system across a device is not how our body is made. Our body is made to be flexible and need to perform a certain range of motions. So we need to design materials that allow that flexibility but support in the right areas. So AiKnit is a revolutionary approach to design new kind of programmable material systems to treat and support the musculoskeletal system. We are using basically fabrication technologies such as 3D printing and 3D knitting to design a modular kind of wearable system which comprises of a compression glove with adaptive areas of support and 3D printed kinematic attachments that you can either fit onto the glove or directly wear on the skin, which allow the user or the patient to adapt and adjust the device in the areas where they need it. They can wash it, they can easily take it on and take it off.
I brought the clinical problem to them of what thumbs do and what thumbs shouldn't do if you're living with osteoarthritis. And they have solved these complex problems with the different characteristics of these materials. They're very comfortable.
So our solutions are for the elderly population as well, to prevent further decline of their conditions, but also to enable them to do things they have always done.
I think having something that does help your problem and your pain helps you to have a better quality of life, but still be able to get on with your life is really important.
I think co-design is really important because you have to listen to users and patients and keep them on your journey in an iterative process and co-design with them your solution. There's a lot of things that are needed in order to set up a business, whether it's like building your team, developing the prototypes, finding a route to market, patenting your IP. So there are a lot of things that are attached to developing a project like this. So funding is crucial at each step of the journey. So I'm hoping to be having a product ready that could be launched into the market within the next 2-3 years. So basically now we are starting to develop our first prototype, which is a glove, but it doesn't stop there. We are planning to develop or deploy or apply these material systems and characteristics in other devices to treat other conditions of the body. We are looking for patients, users and clinicians to give us valuable feedback to iterate on our prototype, and we are looking for investors who believe in our mission and help us bring our first product to market.